Back on the Ortho Nebraska halftime show, where Hastings is 24 minutes away from clinching a playoff berth. They're rolling tonight. Bill Steck is rolling with our friends down on the field. Here's Bill.
Yeah, we're so thankful to Ortho Nebraska. Dr. Jace Heiden, an orthopedic surgeon, is with us now, and we're going to talk about something that sounds a little different: hip impingement injuries. Doc, what exactly is that?
Yeah, so thanks for having us out tonight.
Sure.
So, there's several different kinds of injuries within the hip, whether it be tendonitis or strains of the muscles around the hip, or hip impingement, which is a deeper mechanical issue, kind of deep within the hip, where there's extra bone on the ball or the socket of the hip, and this can kind of come up into contact with other parts of the hip when athletes are playing or practicing their sport and cause some painful symptoms for them.
And what are some of those symptoms?
So athletes can be feeling some pain when they're running, sprinting, kind of flexing up their leg or cutting and pivoting back and forth. It's really common in athletes in crouch positions like our football linemen or hockey goalies or baseball catchers, and also in our gymnasts and dancers who require a lot of hip range of motion and can bring that kind of bone into contact with other parts of their hip and feel pain.
Yeah, and there are some non-surgical things that we can do here?
Yeah, absolutely. Our goal is always to keep players in the game and keep them going at their best. So we always look for our toolbox of non-surgical treatments, things like working with physical therapy or their athletic trainers to strengthen muscles around the hip. We think about injections of a steroid and some numbing medicine to try to limit their symptoms and get them back in the game. If they're still having symptoms after a couple months of that and not able to play up to their expectations, we talk about surgery with hip arthroscopy, where we can shave down some of that extra bone and repair the soft tissues in the hip.
Can you give us a picture of what it looks like with recovery?
Yeah, so the first couple months is getting their normal range of motion back and their walking and gait. The next couple months we progress back to dynamic running and cutting pivoting activities, and then finally the time frame about 5 to 7 months we're clearing our patients, our athletes, back to full return to sport.
Yeah, and we always like saying, hey, remember that at the Oakview office, your extended office hours are at 8 o'clock in the morning. You kind of hope they don't need you, but they're there if you're there if they need you.
Yeah, absolutely. We're there if you need us. If not, we're cheering you on the sidelines.
All right, guys, back to you.
Thanks, Doctor. Thanks, Bill. Todd, my partner can relate to that. More on the Ortho Nebraska halftime show from Ralston after these messages.